press conference for the City of Lubbock. Today on our panel, we have the Director of Public Health, Catherine Wells, our Public Health Authority, Dr. Ron Cook. We have Mayor Pro Tem and District 4 City Council Member and the Lubbock Economic Recovery Task Force Co-Chair, Mr. Steve Massengale. And then we also have Mayor Dan Pope. As a reminder, we'll go through all of the panelists and then we will open it up for media questions. Each media outlet will receive a question and then a follow-up. So I will turn it over to Ms. Catherine Wells.
Thank you, Abby. Good morning, everyone. Again, this week, I get to report positive news. Our case numbers continue to be low, and even over the weekend, our case numbers dropped below 100. It's been months since we have had days under 100. We're also seeing a decrease in our hospital rate. With both having fewer case counts, we're also, with having fewer cases, we now have fewer individuals that are requiring hospitalization. Our state reported, or our area reported a hospital rate of just over 15%. And the last time we were able to report a number that low was back in November. This downward trend is because we as a community are following these public health guidelines that we've been talking about for months. We need to continue this as we work to increase the vaccinations in our community. Let's not let our guard down. We need to continue social distancing, hand washing, and wearing a mask. It's going to take time and manpower to get enough vaccines here where we can start dropping some of these other public health measures. But it's coming. We are continuing to work on increasing those vaccines, and we will hopefully continue to see these lower case counts. Today, I really want to focus again on our vaccine clinics, especially talk about second doses. The goal is for everyone to receive their second dose within 28 days after they got their first. And this is specifically for people seen at the Civic Center Clinic with the Moderna. However, there is some flexibility in that 28 days. Our goal is really to make sure individuals get back into the clinic within a week of that 28-day mark. We do need individuals to make appointments for that second dose. To accommodate everyone, we are opening a clinic. We'll have clinics running 4 days a week instead of 3 starting next week. And then we're also expanding some of our clinic hours so we can accommodate more individuals getting their second dose and also continue to bring people in for that first dose. Appointment scheduling started today through Select a Seat, and the community can now book their second appointment if you received your first dose on or before January 16th. Each week, we will automatically open up another block of appointments, and you should be able to book an appointment about 2 weeks after you got that first dose, and then try to book within a week. You can book through Select a Seat, even if you scheduled your first appointment through the health department. We're really encouraging everyone to use the Select a Seat option. But if you don't have access to a computer or the internet, you are welcome to call the health department at 806-775-2933. Our staff is also making appointments for those same dates. I encourage everybody to make sure that they get that second appointment when it's their time. With that, I will pass it over to Dr. Cook.
Thank you, Catherine. That is good news. And I want everybody to know, and you may have seen this on the news, that our community, because of Catherine and the mayor's help, and kudos to their teams, that we are the third highest city in the nation that's giving out vaccine. Even with the amount that we've given, we are pushing it out as fast as we can get it. So kudos to the mayor and kudos to Catherine and her team on getting that done for our community. Again, our hospitals remain full. So as our COVID numbers go down, we still have all those other individuals that would normally be sick and need to be hospitalized with trauma or other illnesses are still coming into our hospitals. And so they're full. In fact, if you saw the news last night, there were 13 people waiting in our ICUs that still needed beds. So as our numbers of COVID go down, Our ICUs in our hospitals still remain full. That's just part of this season that our hospitals are pretty busy. The good news is here, because of all of our mitigation efforts, in other words, you wearing your mask and social distancing and washing our hands, our flu numbers are very, very low. There's a little bit out there, but significantly low. Typically this time of year, between at the end of January and the beginning of February, our flu numbers typically peak and are very high, but not this year. We saw some of this evidence in South America a few months ago, and certainly it is replicated here. So all of your efforts of keeping the flu away and slowing down our COVID infections are working. And just like Catherine said, we cannot stop. We must continue to wear a mask and socially distance and wash our hands. I truly believe we will not have enough people vaccinated until probably midsummer, late summer. So we're going to have to continue wearing our mask and doing those sorts of things until then, even though we're right at the cusp of that 15%. And if we're below 15% for 7 days, we can even open up more. But still, we must continue to wear a mask and socially distance and wash our hands. So congratulations, everybody. Thanks for all that hard work. We can't stop now. We must continue those efforts. Our antibody infusion clinics are still open. In fact, we do have a third one now that's open, and it's open at the Grace Hospital on 50th and University. So if you qualify, in other words, if you're turned positive, if you get a positive test, and within 5 days of that positive test, and you're 65 and above, or you have uncontrolled diabetes, hypertension, an immune disease, chronic kidney disease, obesity, then you would qualify to get this antibody infusion. So please talk to your primary care provider, your primary care physician, and get referred to that center. So there's evidence that it does help prevent you from being hospitalized. I do believe that this is another thing that's keeping our hospital numbers low. This is fantastic news. Now, remember, if you do get that infusion, you're not really eligible for the vaccine for 90 days after that. One, because you've built up, your body has built up antibodies to that virus because you're infected with it. That's protection number one. Protection number two are the antibodies that were infused into you with that antibody cocktail. There may be some cross reactivity with the vaccine that the antibodies that you've received may neutralize the vaccine from those antibody infusions. So that's why we say we need to wait 90 days before you get the vaccine. There will be, I am encouraged that I really believe that we're going to have plenty of vaccine as it continues to get pushed out. There's more vaccine coming. As Catherine described, we're going to both do primary doses and secondary doses down at the Civic Center. And again, it's 94 to 95% effective. And if it's your turn to get that second dose, please show up to get that second dose. You can't get it early, but you can get it up to 42 days past that first dose. So that's good news. You have up to 6 weeks to get that second dose. Please do so. Don't panic. We have plenty of vaccine. We're encouraged that we're getting vaccine for those second doses. And remember, if you had a little bit of reaction to the first dose, you're going to have at least a little bit of reaction, maybe a little bit more. That's just your immune system doing its job, because now it's seen that virus. It's seen a little bit of that virus. It made antibodies against it. And so it's going to jump on it sooner and try to stop that. And the way we do that is to increase our temperature. We might have chills. We're going to get muscle soreness. Those sorts of things are all normal to the vaccine. So when you get your second dose, you might have a little more vigorous reaction, but it's a very safe vaccine. Only like 2 patients per 1 million doses given have an allergic reaction to the vaccine. That's very, very low. Your likelihood of getting the virus is much greater than just having a reaction to the vaccine. As you know, and you've heard, we've had lots of news about the new mutations that are coming, or new variants coming out of the vaccine, of the virus. That's what viruses do. They mutate. We chase this circle every year with the flu vaccine. Everything that we have thus far and everything that we know about the mutations of the virus it looks like our current vaccines are covering it very, very well. So don't fear yet. That's all good news. The best news, or the best thing that you can do, is still stop the spread of that virus by wearing your mask and socially distancing and washing your hands. Do I believe it's here? I don't know that it's here. I have suspicions that, if it's everywhere else in the United States, it very well could be here. We're a very transient society. We go all kinds of places. So the likelihood of it being already here in Lubbock is significant. The best thing that we can do, again, is wear a mask and socially distance. That's all that I have. We must continue to respect this virus. Every day we continue to put patients in the hospital. Every day we continue to put patients in the ICUs. And every day people succumb to this lethal disease. So still respect this virus. And the best thing that you can do to show that you care about other people is still to wear a mask and socially distance. That's all that I have. Let me hand this off to the Mayor Pro Tem, Mr. Massengill.
Thank you, Dr. Cook. Thank you for your comments today. Good morning, everybody. I'm going to talk about how you get registered for your second vaccine. I'm going to share my screen here to get started. Okay. I'm assuming everybody can see my screen at this time. This is the City of Lubbock homepage. So a couple of don'ts before we get into what makes this easy. Don't walk up for your second dose, and do not come before. All right, I've been told I've got some technical difficulties here. Stand by. Okay, my apologies. Now can you see my screen now? Okay. I'm on the City of Lubbock homepage here. Let me reiterate a couple of things. Don't come before your 28-day time period from your first vaccine. And second, don't walk up for your second dose. So here we go. You're going to come to the City of Lubbock homepage, and you're going to come down here where you see featured news, and it says COVID-19 vaccine update, and you're going to click on scheduling details for a second dose. Now there's some information here that I think is important to read through, but what's important is to come down to this link right here, mylubbock.info/dose2. And I'm going to click on that. And here's what you see are some hyperlinks for scheduling for your second dose. So if your first dose was on or before January 5th, you're going to click on that link. And what this is going to do is bring us into the select a seat queue, okay? And I'm going to show you how quickly we got in there. And this is going to be how you're going to select your reservation, okay? So it's that simple. I'm going to stop my share here, hopefully not have any more technical difficulties. So we cannot handle the call load if everybody calls. So let's start with select a seat. If you are unable to get online and get access, you can call the health department at 775-2933. I know second dose is on everybody's mind this week. We have your second dose, and we're going to make it as easy as possible for you to get your reservation and get over to the Civic Center and get your vaccination. There will be an identified second line for those coming to get your second dose. Please bring the card that you received from your first dose. It's going to slow down your process if you've lost your card, okay? I believe there'll be another table, a sign-up table, or for you to talk to somebody if you've forgotten your card. So with that, I'm going to hand this over to Mayor Dan Pope.
Thanks, Steve. Good morning, everyone. I want to start with a screen share and share a little data as we do every week. Okay. Catherine and Ron both alluded to the hospitalization rate, but here it is graphically. Remember that if we're below 15% for 7 consecutive days, we're able to reopen our economy a click. That would mean that restaurants can go to 75% occupancy and that bars can reopen at 50%. I think that's a goal, something that we should all work towards. Pardon me. This is our case count by age group over the last 2 weeks. You'll see that these numbers continue to go down. The distribution is very similar. And you might note that over the last week, as Ms. Wells was talking about, we've averaged just a little more than 100 new cases a day, 105 new cases a day over the last week. And finally, hospital beds, and this is our graphic that points this out very clearly. Although the pressure on our hospitals for COVID is going down, this is the time of year that hospitals experience a high census for other medical needs. And so they're still under pressure. And we want to make sure we share this with you. Okay. So let me first of all start by reminding everyone that we remain empathetic for the impact that the virus, this pandemic has had on families, on businesses. We all have our stories, and it's significant, and we don't in any way want to push that aside. I want to thank the state and Texas Department of Emergency Management for continuing to be a good partner. We talked last Wednesday morning about the infusion site that opened at the old Grace Hospital at 50th and University. You know by now that on Monday of this week, we opened what the state calls an alternate care site, or an ACS, in that same hospital up on the 3rd floor. That has 20 COVID beds in it. They're set up for less sick patients, not as high of acuity, but regardless, it's a very effective way to take pressure off of our hospitals locally in our region. And then ultimately, if we can serve a larger area, then we will do that. So thank you for that. I thought you might find these numbers interesting. The state says that there are 123,423 eligible Lubbock County residents in the 1A and 1B vaccination groups, okay? 24% of those have received their first dose. That's good news. Now, the vast majority of 1A have received their first dose, and we're chipping away at the 1B, but it's a large number, and at 5,000 a week, you can see that it's going to take us a while. There are about 244,000 residents in Lubbock County over the age of 16. 12.3% of them have received their first dose. So progress is being made. It is not as fast as some of us would like, but it is measurable and it's consistent. And I think we can plan on at least these 5,000 doses for the next couple weeks. We continue to talk to the state. We're ready to take more as they become available. We're pleased with the demand, the number of people that want to have the vaccine. I think it's important that we realize that this vaccine is both effective and safe. That's important when we think about a decision to be vaccinated. I encourage you to be patient. I think Councilman Massengill really pointed out how we register for the second dose. Remember that if you've gotten your first dose, we guarantee you there's a second dose. It may not happen on the 29th day after you got the first one, but we'll have an appointment for you to get it. Don't walk up. Ideally, go online to make your appointment. If you can't do it that way, give us a call. Be patient. Please remain hopeful. Let's stay the course. We're on the right track. Thank you for all of your work. I'm so blessed to be able to serve as your mayor. And I like to be able to say, I think today we can say it's a great day in Lubbock, Texas. Abby, back to you.
Thank you, Mayor Pope. And now I'm going to ask all the panelists to turn on their cameras, and we will start with the media questions. So first we have Olga Aguero with El Editor. Olga, are you with us?
Good morning, I sure am. It's good to see everybody. And yes, today is a beautiful day now that we have a national plan, and we didn't have that. And I think that's going to be encouraging for all this process that y'all have in place to take gear, and we're going to kick it in as fast as they come in, which is great. That is what we need. My parents got a call this morning, Catherine, I'm sorry, to remind them about their second dose. They gave them an appointment. Do they still need to register? And when people are getting their second dose, are they given some kind of a talk as what to expect? Because I understand they will have like flu symptoms. Some of them will. People are different. So will that be also told to them at that time?
Yeah, we do provide education when people are receiving that second dose to let them know that, some people experience, some flu-like symptoms. I had my second dose a couple days ago, and I was definitely tired after it, but after a good night's sleep, definitely felt better. So we are providing that education. As far as somebody calling them, we've done some return calls when people leave a message. We haven't started a process to call back people to remind them.
Okay, well, they got a call this morning to remind them that their second dose was scheduled for 11 o'clock at the Civic Center on Wednesday of next week. So the question again is, do they still need to register online, or do they just go by what they were told?
No, if they received a call from the health department, then they are confirmed.
Okay, very good. The second question is, let me see, what was it? Okay, we haven't heard much about tracers. Are tracers still in the picture? I hope so. And then the last week I had asked about if the vaccines could be mixed, Pfizer and Moderna, just depending. I heard on the CNN national news that you could have them mixed. So I just wanted to bring that up front and see what y'all know here in the local level.
We want people to get the same vaccine brand that they received the first time.
Okay, very
And
good.
that's really the most important thing. And we have the places that had Pfizer initially in Lubbock, they have second doses. At the Civic Center, if you got Moderna, that second dose is available. And yes, our contact tracing continues. The health department is still working on that front also. So have staff back here at the health department that's doing contact tracing. I have staff in Lubbock Fire Rescue at the clinic and a whole group of staff answering phones. So we continue to increase the number of people working on COVID in the health department.
Thank you very much. Bless y'all.
Thank you, Olga. Next, we have Matthew Stell with KMAC News.
Thanks so much, Abby. Good to see everybody. Mr. Mayor, first question is for you. You mentioned about
Matt, where you been? We missed you for a couple of weeks. We thought you'd quit on us.
Yeah, I did not. Hey, I took a little vacation a few days ago, but I'm back in.
Okay,
Ready
good. Welcome back. Welcome back.
Thank you. I appreciate it. Question for you real quick. You talked about the 15% threshold and then how we're starting to get back down to that, but we have to stay under that threshold for at least 7 days to reopen those businesses back to 75%. How confident do you think we can get back to that and stay under that 15% threshold?
How confident? Is that your question?
Yeah.
I think we're on a good track, Matt. I don't think it's I would be surprised if it will go 7 straight days, but I do like the trend. And I would think that by the end of February, we likely could find ourselves in that position. I think that would be a good spot to be. By then we will have, twice as many people with their first dose of the vaccine, which helps us also. So those are my thoughts. I don't know if I can give you a confidence rating, but that's my sort of lens over for the next 30 days.
All right, yeah, that works. Second question, it can either be for Dr. Cook or Catherine. Are there folks who are coming out of town, don't live in Lubbock, coming to get vaccines? And if so, what's the farthest someone has probably traveled to get the vaccine if they have come to Lubbock?
I can't answer furthest. I can say that there's been a lot of interest from our surrounding counties. Individuals who would typically come into Lubbock for their health care are coming into the Civic Center for vaccine, and that is a regional clinic. So we are going to serve, anybody who can come into Lubbock. It's an asset for all of us, a resource.
All right, thank y'all.
Thanks, Matt.
Thank you, Matthew. Next, we have Bao Tran with the Daily Toreador.
Well, thank you. I would like to have a question with Dr. Cook. So recently, it has been known that Lubbock is third in the nation for vaccination rate. And as of now, we have had 3 days with less than 100 cases. So how do you believe these were accomplished?
Thanks, Val. The mayor's insistence from the state that we continue to be a hub, which was really good for our community and surrounding community. And then also our efforts and Catherine's efforts down at the Civic Center to really push all of those, 5,000 patients. That's a task trying to get that done. She has done it, and she and her team have done it successfully. And all those people that are involved in trying to get it done, all of our volunteers that are down there helping. My administrative assistant is down there right now helping. And so it's the entire community's effort. And if you've been down there, it is a machine, and people are in and out typically within 30 minutes. And that includes the 15-minute wait time. And so there's always a little hiccups, Val, but for the most part, it's a machine down there, and they're doing an excellent job. That's how we did it.
All right. So next question. As a student of Texas Tech, how long will it take for the vaccine to become widely available for all Texas Tech students?
Texas Tech students in those age groups are at least in phase 3, unless you have a high risk condition, and that's different. I know that Student Health Services and the university is working on trying to make sure that they're in line to get vaccine when it becomes available for those patient populations. And so they're ready to go. They just don't have access to the vaccine yet because that's not the phase that we're vaccinating. I don't have any idea when we'll get to phase 3. It'll be a few months, I think. Yeah.
Right. My next question is for Catherine. With a lot of people moving back from Lubbock after Xmas and New Year, so will the vaccine be readily distributed so that a case spike could be prevented?
We are distributing every dose that comes into the health department. So our goal is to get, if you're here in Lubbock and you fall in that 1A or 1B, our goal is to get you vaccinated through that clinic.
All right. And finally, when a vial vaccine is open, it's useful for only a limited time. So have there been days where you have had leftover vaccines? And if so, what did you do with them?
We make sure that vaccine goes into somebody's arm. Our goal is not to have any waste, and we have not had any waste out of that clinic yet.
All right, that's all the question I have. Thank you so much.
Thanks, Bao. Next, we have Christy Martinez Garcia with Latino Lubbock Magazine.
Good afternoon, everybody. Catherine, are you concerned that, there's been some uncertainty that is about vaccines on a national level? And I know that we were told by Councilman Massengale to expect 5,000 vaccine doses weekly, and which has been great. But are you concerned that that may not continue with all of the shortages happening across the nation?
Our communication with the state is they're really dedicated to making sure that these vaccine hubs in Texas are receiving large quantities of vaccine. And we have been designated as one of those hubs for at least 3 weeks now. And we will continue, as long as they continue to give us those first doses, we will continue to vaccinate individuals. And those second doses are in a different pot of vaccine. So we will continue to even have those second doses, even if they were to reduce our first dose allocations.
And by the way, Catherine, kudos to you and all that are working with you. You guys are doing a great job. Dr.
Thank
Cook,
you.
my next question is for you because, we have seen decreases in the numbers, which is wonderful. Unfortunately, we're still seeing a high death count. With the antibodies that we're now distributing, why do you think that those numbers continue to stay consistent?
Christy, that probably there's always a lag in the time that the numbers decrease, and then it'll take several weeks for those numbers to decrease that involve either significant illness and or deaths. We saw the same thing on the other side of the slope. As we saw our increase in numbers go up, the death rate lagged behind several weeks. And so these patients are significantly sick. And it may take, the average hospital stay is, if you're in the ICU, is roughly 3 weeks. And that doesn't account for the long haulers that may have significant disease that are discharged from the hospital. They go home, they're convalescing at home, and then they take a downward turn and develop what we call a pulmonary embolus or some other issue that may happen later, or they just don't do well. So there's always a lag time. Long answer, there's a lag time.
Mm-hmm. Mayor, my next question is for you. I'm just kidding. Sorry. But
that's, Christy, that's the funniest thing you've said all year. So that's good.
I said James. But Mayor, you know what? If you go by Broadway, you will see a lot of students not wearing masks. How are we going to make sure that we continue to mandate that?
Well, we're going to keep doing what we've been doing for the last 10 months, Christy. We're going to remind people about the consequences of irresponsible behavior. And the vast majority of our citizens are and businesses are doing the right thing. They're good actors. And we still get a handful of calls a week about, hey, we don't think these folks are following the guidelines, or would you offer some encouragement here about, and we're still responding, and we go out there with the fire marshal's office or with LPD, and we do what we've been doing since the spring, and we're in no way have we pulled back from that. That's still our commitment to the community. And people like you, Christy, allow us to tell that story, asking these kind of questions, and what you do in your publication and online, and that's just very valuable. So let's all stay the course.
Thank you, Christy. Next, we have Terry Furman with KLBK News.
Good afternoon, everybody.
Hey,
My
Terry.
first question is this. We've seen the college kids come back, and because I drive home late at night, I've seen several bars that are filled to the max. I know we're not down to where they can have more than 25%. What are we doing to kind of combat that?
Well, we talked about this last week. I'm glad you brought it up again. So the bars are under the purview of the Texas Alcoholic Beverage Commission. They were here 2 separate weekends in December. Everyone that has an alcohol license, on-premise license, got at least 1 visit. Most got 2, and some got more than that. Many of these, what we think of as bars, traditionally have changed their licensing to allow themselves to open up and serve food and alcohol. However, they still are under very strict requirements of the governor's order. We had very few problems the last time TABC was here. So we're talking 5 weeks ago. We'll address the situations. If you've got specific situations, we certainly are in partnership and in communication with the state, and we'll work with them on individual spots. I do agree that there was a bit more buzz in the community last week with college students being back.
All right, my second question is this. We focused a lot on those second doses, but when we get the notification that y'all are opening a new clinic for, say, the first doses, those are filled before typically we can get them even on air. Is there anything that you would encourage people who haven't been able to make an appointment? How are they supposed to do that? Just keep trying, just keep doing what they're doing? What is the recommendation?
Well, I'll start and I'll let Catherine tag on this. I think it appears to me, from what I can gather, that the select a seat option is your best bet. Now, if you've not gone on and registered yourself on select a seat, you might want to do that in advance. I think that would help you with the process. But we talked about the fact that we're only 24% down the road of our estimated 1A and 1B population. So that means 3 are on the outside looking in for every one that's gotten the vaccine. It's a bit of a numbers game. So I preach patience and just sticking with it. Catherine, what would you add to that?
And we're working on getting a regular cycle of when we will open clinic appointments. What happens over the weekend is we have to take inventory, see what the allotments are from the state, figure out exactly how many appointments are available, and our goals to begin opening those appointments kind of at that 10 o'clock on Monday morning, so that people can be ready and everybody knows when that starts.
If I could jump in.
Please.
Let me go back. If you were watching when I was sharing my screen, when I could share my screen, those links that we talked about are specific to second dose reservations.
Right.
Don't make your don't make your second dose reservation on a first dose link. But that should help that those links are dedicated to second dose reservations.
That's a good point.
Okay, so you want them to call the health department then to get in for the first dose?
No.
We'll also open select a seat.
Okay.
I think what's on Monday, or when we're able to do the count and know exactly how many first doses we can guarantee for our community, we will open up select a seat for first doses.
Okay, very good. I'm clear now. Thank you.
All right.
Thank you, Terry. Next, we have Karen McKay with KCBD News.
I noticed, good morning, everybody, and I noticed Catherine sent an email out this week saying, please don't come earlier than 15 minutes. And now we've heard a couple of you say this morning, don't just show up. So can you explain the process? What happens when people get antsy and they think, I'm just going to go wait it out and show up? What happens? Are they sent home, or does it just slow the process? Or will they eventually, if they stick to it, get something before you close at the end of the day, get the vaccine that they want?
Catherine?
Yeah, the clinic, we want people to have appointments. If we schedule the appointments in blocks, so we're putting a certain number of people through that clinic per hour, and that's what allows us to get people in and out in that 45 minute goal. There are some limited walk-ups, and if you are to walk up, you can put your name on a list. However, we will not see you in that clinic until if there's extra vaccine available, and we're starting to do those counts, there was cancellations, we will try to work in those walk-ups, but we're not even going to start to work you in until an hour and a half before clinic closure. So there are people there waiting in the Civic Center right now, hoping to get a vaccine. But if you make an appointment, we guarantee you're getting a vaccine on the day of your appointment.
Okay, thanks for explaining that. And also, we hear so much about 1A, 1B, and I think somebody mentioned earlier phase 3 with Texas Tech students could open up later. Can you kind of clarify this on where we are exactly now and what the next step is going to be, so people will know where they might fit into this whole schedule over the next weeks and months? What's the next thing that will be opening, and who would qualify under that next phase or at 1C or wherever we're going next?
Certainly, Karen. So phase 1A is healthcare workers, frontline workers. Phase 1B, the state of Texas is a bit deviated from the CDC guidance on phase 1, who phase 1B was. Phase 2A was really 65 and older with significant disease, but they have, the state of Texas has said 1B should include those individuals that are 65 and older, or those individuals that have 16 and older with comorbid disease, and other people like school teachers and that sort of thing. Phase 2 is then those other people that are not as high risk, but still it's significantly higher than the younger population. And then so phase 3 would be school age children, including college age people.
So where are we right now? Are we in phase 2 yet?
No, we're still in phase 1.
We're still the 1A. And
1A, and we're going to be there a while. There's still a significant number of people in our community that are 65 and older, they're 65 and older, and 16 and older that have significant comorbid diseases, diabetes, hypertension, obesity, all those sorts of things, chronic kidney disease. We still have a number of individuals in our communities that need to be vaccinated before we get to phase 2.
So my question was then, looking down the road, are we talking weeks or months before you think we'll move on to that next group?
That all depends on how many people we can get vaccinated and how much vaccine we have. It's hard to predict. It's going to be weeks yet, I think.
Months. Let's set the right expectation, Karen. It's not going to be weeks.
But remember, those individuals will do much better. Those people in 2 and 3 are going to do much better than the people in 1A and 1B. The goal here is to prevent significant disease that causes hospitalizations and death. You may get sick if you're in phase 3, but the likelihood of you doing well is significantly greater than somebody that's 65 or has a significant comorbid disease.
Okay, that makes sense. Thank you.
Mm-hmm.
Thank you, Karen. Next, we have Matt Dotre with Lubbock Avalanche Journal.
Good afternoon. So, Dr. Cook, when can we expect, I keep hearing about this Johnson & Johnson vaccine. When are we expecting this?
So just before this press conference started, the White House was giving a press conference on the vaccines and updates, and that's where I was listening to it. I didn't have a chance to get those into my notes. Probably the state is looking at, and Dr. Fauci was talking about, the next ones in line that are in phase 3 and expect to present their data to the FDA or Johnson & Johnson. So it's Janssen/Johnson & Johnson Pharmaceuticals. The other one is AstraZeneca. And so they expect by the end of February, maybe in another week or so, that they will go in front of the FDA. And by the end of February, first part of March, it may be approved. And so then it can immediately be shipped out probably within 48 hours.
Okay.
Pfizer's.
And is that when you think we'll start to see more vaccines at pharmacies? I think I read that that's a big push from the Biden administration.
It's certainly more vaccines that flood the market, the more people that have access to distribute and vaccinate individuals. And so, Catherine's job, the Civic Center clinic vaccination is great. We cannot vaccinate everybody. We're doing a great job, but we need other people. United Pharmacies has a plan. Walgreens has a plan. All these other people, we need their help too. It's just that right now the vaccines are directed toward these hubs where they can, with what vaccines we have, they can get it out the fastest.
Very good. Ms. Wells, can you talk a bit about how you're cleaning the Civic Center?
Yeah, one of the benefits of having the clinic at the Civic Center is we also have access to all of the clinic center cleaning staff, their janitorial staff. So at the end of the day, they're doing a deep clean. And then throughout the day, we have individuals wiping down chairs and tables and people cleaning the bathrooms. So I'm very confident about those cleaning protocols we have.
Very good, thanks. I was just curious. Thank you.
Thank you, Matt. And finally, we have Sarah Self-Walbrick with TTU Public Media.
Hey y'all, I think everyone's kind of addressed this in their own way already, but I do want to ask it directly. Today actually marks 100 days that we've been over that state set threshold for high COVID hospitalizations. What's different now about our hospital situation compared to October? And what have we learned about treating and mitigating COVID during this time?
Well, I'll start with what's different now, then we'll let Dr. Cook talk about the treatments. I think it's, Sarah, I believe it's evident that the spread of COVID has receded in our community. And if you look at our data, you follow that as closely as we do. I think a couple of things contribute to that. One is cold weather probably drives us inside more. There's less gatherings. I think we did a very good job over the holidays, Thanksgiving and Christmas, New Year's. I think we did things differently. Many of us can tell stories that we'll never forget about, you know, how boring Thanksgiving was, as an example. My dog's still talking about it. No, I'm just kidding. But it's slowed down the spread. I think the college kids going home, I think it was a really wise decision to give them a 60-day break, or roughly that. They're back now. We've vaccinated a good portion of our population. We hope that we can keep the spread slow. Now, Dr. Cook, I know we continue to change the way that physicians are dealing with this, the way they're handling it and their practices, and you may want to talk a bit about that.
Good. Thank you, sir. You know, the more we get exposed and the more exposed to patients that have this is what I mean by that. We learn better how to treat this virus. And so this has been a virus that's not just like your typical pneumonia. It's not like your typical overwhelming, what we call sepsis, where your body's completely infected. We see some similarities, but some of those things that we've used in the past don't work on this virus. And so as time goes on, the medical community, the medical knowledge base talks to each other all the time, not just here. We talk to people everywhere across the nation. How are you doing this? What's working for you? And we see stuff in literature, and we have communications and trying to learn how to best take care of these things. We've come along and figured out what is working better. We have no absolute fix. Just because we can make things better and remove those things that might occur, it still takes time to heal. But learning when to give steroids. So giving steroids right off the bat is not the best thing. We've learned that. Giving everybody anticoagulation right off the bat isn't always the right thing. We find out, does this drug work? No, there's enough studies now. We've given it to enough people, it didn't work, and patients still continue to decline. So as we work through this, we've gotten better at determining which drugs are the most effective to try, and the timing of those drugs. Just because we say steroids work, they don't always work at, you just can't walk up and give everybody steroids, because there's consequences to giving everybody steroids that are positive with the virus. So we're learning the timeline on exactly when to give things as we should. And then the new drugs, do the new drugs work? Do the old drugs work? Some do, some don't. That's the old hydroxychloroquine study that everybody thought it worked at first, and then, but we have to practice good medicine. I can't give you a drug and expect it to work and then have a bad outcome when I know that it may or may not be clearly indicated.
Dr. Cook, don't you think the antibody, the therapeutics have helped with this too? I mean, wouldn't that be a contributor?
Yes, I think, our ability to infuse the antibody cocktails, either Regeneron or bamlanivimab, it has helped our community some. It's not a panacea, but it does help. And so there is no absolute one drug that's going to make everything better. What we do know, again, and I'm going to get back on my soapbox, is that those mitigation efforts to stop the spread of the virus, wearing a mask, social distancing, washing your hands, making sure you stay in small crowds, those things absolutely do slow the spread of the virus. It's about slowing the spread of the virus and not overwhelming our healthcare system.
Absolutely. Thank you both for such thorough answers. Mary, you know I appreciate a good dog joke so thanks.
I knew you did. So I dropped that in there for you, Sarah.
Thank you so much. My second question is a quick one. Now that we're over a month into vaccinating healthcare workers, has that helped with staffing problems at our hospitals?
Ron, do you want to take that one?
It has. Their numbers, we still have people that get sick. We still have people that get fever, and people that are exposed to family members, those sorts of things. But it has significantly decreased the number of people that in our workforce that can take care of people.
Good to hear. Thank y'all.
Thanks, Sarah.
Thanks, Sarah.
Thank you, Sarah. That concludes our media questions. Unless the panel has a final word, I will close our press conference for the day.
Thank you.
All right, thank you for attending, and please make sure to follow the City of Lubbock's website and social media sites. Please follow along for updates, and we will see you next time.